Aminoglycosides are classified as bactericidal antibiotics that work against gram-negative bacteria such as Pseudomonas, which is pictured here.
Aminoglycosides work by inhibiting protein synthesis, which disrupts the bacteria's ability to build a cell wall or membrane.
Aminoglycosides are indicated when there is an infection from gram-negative bacteria such as Pseudomonas, Acinetobacter, and Enterobacter. They are also effective against some species of mycobacteria, including the causative agent of tuberculosis.
The most frequent use of aminoglycosides is empiric therapy for serious infections such as septicemia, intra-abdominal infections, urinary tract infections, and nosocomial respiratory tract infections.
They are contraindicated in myasthenia gravis patients due to it exacerbating their weakness. They are also contraindicated in patients with mitochondrial diseases because it may cause hearing loss, tinnitus, cardiac toxicity, and renal toxicity.
Most aminoglycosides are pregnancy category D. They should be avoided with pregnant women if possible.
Because they aren't absorbed in the gut, aminoglycosides are typically given intramuscularly and intravenously. They also have a topical and otic version of these drugs.
Aminoglycosides have a narrow therapeutic index. Toxic levels are known to cause ototoxic damage, vestibular toxic impairment, nephrotoxicity, and encephalopathy.
These drugs may potentially cause hearing loss, vision loss, and cognitive impairment.
Some other common side effects are upset stomach, diarrhea, allergic reactions, rash, and nausea or vomiting.
Things you may need to consider as a nurse are checking the function of the 8th cranial nerve to assess for hearing loss. You should also monitor BUN and creatinine levels to catch nephrotoxicity. Aminoglycosides are usually prescribed for 7 to 10 days. Make sure to educate your patients on finishing their prescription. Encourage fluid intake and small frequent meals to mitigate potential side effects. Be sure to monitor for therapeutic effects of the drug. One common aminoglycoside is streptomycin. It is traditionally given intramuscularly for endocarditis, tuberculosis, plague, and tularemia. It was the first discovered aminoglycoside, and it was the first effective treatment for tuberculosis.
Another drug in this class is neomycin. It is mainly found in topical medications such as creams and ointments to treat or prevent infections in minor cuts, scrapes, or burns.
Gentamicin is used for several types of bacterial infections such as bone infections, endocarditis, pelvic inflammatory disease, meningitis, pneumonia, urinary tract infections, sepsis, and many others. It is often used for only 2 days because of its toxic effects. Here's a list of other aminoglycosides. Each one treats a variety of gram-negative bacterial infections. Tobramycin may be inhaled to treat lung infections in those with cystic fibrosis. Sisomycin is a new drug in this class and is also effective with gram-positive bacteria.